July 2015, I learned that I do not control my life. At the time, my wife and I had an 18-month-old boy. Let me tell you about 18-month-old boys. They reach peak cuteness at 18 months. This is, I believe, why a lot of parents decide to have more children at that time, because their babies are walking and talking and they don't really have a very strong opinion yet, and they're just ultimate cute. So my wife and I, of course, decided that it would be a great time, a perfect time to have a second child. And then we found out we were going to have a baby. And a couple months later, my wife calls me after visiting with her doctor, and she said, "Babe, we're having twins." And I was at work when she called me, so I did what any self-respecting, expecting second time, maybe second and third time father would do. And I went to the lobby and sat in a chair and put my head in my hands and stared at the ground for several minutes until I finally decided I'm not going to be able to get any work done today. I'd better just go home. Little did my wife and I know at that time how many miracles we would see, but how many scary close calls we would see in the process of having twins. Today, my speech is about how a certain condition called twin-to-twin transfusion syndrome, which is a rare condition, but one that can teach us about maternal and fetal medicine, that as nurses, we can begin to understand how important maternal medicine is. And so this is an example of a situation that can occur that can help us to see into all the reasons that maternal medicine can be such an unpredictable type of medicine. It's been around as long as anything, as humans have been having babies for hundreds of thousands of years. And so as a rare condition now that we can treat, this can persuade nurses to understand and listen to mothers in their intuition. And that's where I'd like to start with my first idea, which will be that maternal medicine is natural. We can improve outcomes with science. Each pregnancy is different and unique. And so a mother's intuition is something that can't really be explained by science, but is certainly upheld by science. And third, that we can embolden women and improve outcomes by listening to them better and more. We start again at the beginning. There have been mothers and women have helped each other with having children through the process ever since the beginning of humans, roughly 100 to 200,000 years ago. And while medicine has made childbirth much safer, it's still one of the most dangerous things that a woman will do in her life. Of course, it used to be that women would be very likely to die in childbirth. At least that was one of the highest causes of death. And so, although maternal medicine is natural, it is risky. And so we're going to look at how even though advancements of maternal care and natal care have led to better and more consistent outcomes, how there's still room for improvement. Sometimes it can be perfectly natural and almost everything can be done without intervention, and other times there can be needs for Herculean efforts to preserve life. I also want to address at this moment that there are racial disparities within maternal care. So much so that Black mothers are about 2.9 times more likely to die in childbirth. So maternal death is 2.9 times more frequent for Black women as for white women. And we can look into some of the reasons for that. I'm not going to discuss all of those in this speech, but there's a lot of risk still. And in the United States, we have one of the highest mortality rates as any country that's industrialized. And I believe that some of this comes from not giving full intuition to the mother. And back to our rare scenario, which is called twin-to-twin transfusion syndrome. So first of all, let's talk about the types of twins there are. Of course, there are fraternal twins, and there are what are known as identical twins or monozygotic twins. That's monozygotic because monozygotic twins come from one zygote or one embryo that splits, whereas fraternal twins come from two separate eggs that are each individually fertilized. So monozygotic twins, if they split within sometime about 3 to 5 or 5 to 7 days, they will often be monochorionic, which means that they have one placenta and one chorion, which is a very large, thick sac, and two divided sacs, or as in diamniotic, so two amniotic sacs. Very rarely there's a group called mono or monochorionic, monoamniotic, and those twins don't have a division between them. There's not separate sacs. Again, that's another more rare situation. Monochorionic diamniotic twins are separated by, they're in that large sac together in the monochorionic. They share one placenta, and I'll show you. You should be able to see to my side here a good picture of them, where the sac can actually, that's dividing the two twins, can actually start to shrink around one and not the other. So that's because there are still some blood, there are still some connections between the twins that are some of the blood vessels, and so the blood from one can be unequally shared with the other. And as this occurs, one of them produces more amniotic fluid that gets produced from the kidneys and excreted through the urine, and that can then, as the recipient twin, as we call it, you have the donor twin and the recipient twin. The recipient twin is processing more blood and therefore creates more amniotic fluid and further worsens the situation where there's an unequal sharing of the fluid. And so this can be a very dangerous situation, and there's multiple stages for that situation. And so if you reach stage 2, borderline even stage 3, that means that you are in that situation shown in the picture that you can see. And once you've reached stage 3, there's such an unequal sharing that 95% of those cases will lead to the loss or the death of at least one of the twins, if not both. So my wife and I found ourselves in this situation um, uh, several weeks after finding out that we were going to be having twins. And so we rushed to. They didn't offer this surgery in our own state, so we actually flew to a neighboring, or not a neighboring state, but we flew to Texas, and were there and were able to receive an operation in Texas. Now, when I talk about how women can have an intuition that um, science can't fully explain, one example of that is that my wife knew that she was going to be having twins before anybody else. She told me, I think I might be having twins, and I said the chances of that seem really low. And so I learned in that situation not to judge, uh, not to doubt a woman's intuition. And that's partly because, with attention to situations that can change in an instant from normal to high risk, um, that brings me to my main point number two, which is, while high risk pregnancies are abnormal, any pregnancies can switch from normal to an emergency in an instant. And we should embolden women to trust their instincts and their motherly intuition. And that's often the reason that they're able to find an anomaly within a pregnancy, is because a woman had the intuition to ask the question. Some examples of when a pregnancy can become more dangerous is in the situation where you have premature preterm rupture of membranes. So after receiving this space-age life-saving surgery for our twins, which was a laser ablation of the connections in between the two of them that was done with a fetoscope the size of a pen, we returned home and she actually ruptured her membranes, and that meant that like her water broke, and she was only at 23 weeks of maternal gestation. And so that was very frightening, especially for us, that there were people who were saying, I think everything's going to be all right. And I said to them, we don't know that at this time. Now, again, my wife actually was more calm than I was, even in that situation, but things were very scary. And again, things can change from a very normal and calm and exciting time to much riskier in an instant. Another example of that changing from everything being normal and calm to an emergency in an instant is known as preeclampsia. Many women experience a very high blood pressure that could be a danger to themselves and to the baby. For instance, if we can listen to women more, we can actually find that there are very many instances that a woman's intuition has actually led to finding a dangerous situation. And so I believe that we should listen to them. And another example of when I think that tuition outweighed a doctor was when the doctor said to us on October 31st, it's very unlikely that your babies will be born today. And that was the day that they were born. And so I definitely put more weight and emphasis in the intuition of a mother, and which means we shouldn't eliminate the intuition of a doctor, but we should listen to the intuition of the mother especially. In essence, control is an illusion. We think we know how our life is going to go, and we think we know how a birth is going to go, and everybody expects to have a normal pregnancy. In fact, when we had our first child, which was a very typical first pregnancy for my wife, we're always hearing people's scariest stories about their pregnancies, and felt like that wasn't always appreciated. However, now we're the ones doing that. We are the ones who, every time somebody tells us they're pregnant, we're like, well, let me tell you a story, and scare them to death. But in our conclusion here, I'd like to say natural miracles and miracles of science will lead to miracles in nursing. And that's particular for mothers. We should teach our patients to trust their intuition and not doubt the voices in their head when they feel like something is wrong. Then we should listen to what they tell you to give each woman her greatest chance at a healthy motherhood. With the example of twin-to-twin transfusion syndrome, which I've described today, that's one rare situation. We can utilize science and embolden mothers' intuition and listen to them effectively. That can improve maternal fetal outcomes for our patients. Again, listen to your patients. Mother's intuition is real. We can measure it, but even if we cannot explain it, the only way to use it is to listen.